Well, let's turn the page. And by the way, if you want to spend some time with Tango and even attend a workshop to really get deeper into this, they will be at IHC Forum West, November 8th through 9th, out in Las Vegas. And as will our next guest on the program. Joining us on the program is a return guest, Seth Ravine, Chief Revenue Officer with Acclaris. Seth, good morning.
Hey, good morning. How are you guys doing today?
Doing great. How are you?
Doing great.
Great.
You coming to us from Minneapolis today?
I am. Sunshine State, so it's wonderful.
Yeah, it's a great time of the year to be in Minneapolis.
Yeah, this is probably the best time of year to be in Minneapolis.
Yeah. Well, Seth, listen, great to have you on again. For our audience that may be listening for the first time, give a little background around Acclaris, and then we'll kind of jump into what you're doing here with this new benchmarking tool.
That's great. Acclaris provides the services and technology to enable our clients to provide a white label offering around account-based health plans. So whether it's an HSA, FSA, HRA, or any type of employee reimbursement plan, they can put their brand on it, and we will do the technology and services. And we provide services within the financial institutions, health plans, TPAs, brokers, and consultants. And now, as part of Willis Towers Watson, extended reach out into the broker space and into employers.
Seth, now talk about this new benchmarking tool that you guys, have launched in the marketplace, and what that is, and what is driving the interest around it.
Yeah, you just heard from Tango and the complexities that our employers are facing in their day-to-day business environment. Our clients, being the aggregators, and their clients, the employers, are asking for the insights that are really going to drive action and the right behaviors within designing their health plans. And so the benchmarking tool really represents an augmentation of our existing reporting tools that puts or ad hoc reporting into the hands of business users so they can make strategic decisions about their plan designs within the context of market trends. And that's really the key right now for our employer groups. Really, how do I take the insights and the data and then turn those into actions that are going to benefit my employees?
Yeah, Seth, Ron Bachman here. Welcome to the program again. How the benefits administration people, how do they actually use this benchmarking tools? Is it something that's on the computer daily, is updated every 24 hours, updated continuously? And what does it really show them? What does the benchmarking tool look like as best you can describe it on a radio program?
Yeah, the key to this is that it's simple and clean. So through their Acclaris portal, they'll have access to the benchmarking tool. And it's just in addition to our already existing reporting library. But what this does is that on a nightly basis, as we refresh our total book of business, they can run a variety of reports that not only shows, whether it's at the employer level or if they're an aggregator across their book of business, how the trends are looking, but then also compare that to the total Acclaris book of business. And why that's unique is, this is really meant to be for non-technical, non-analytical business users who want to think about, ask the questions, what's going on in my business and why is something happening?
Seth, is this tool available right now? Is it available now?
Yeah, we are. We've rolled it out into through our beta and is now open to general release.
So what are some of the trends that you're seeing? Are the geographical trends in benefit designs, or are there industry trends? What are some of the things that maybe you could share with the audience that your tool is turning up for the marketplace as a whole?
Yeah, and the tool itself is not meant to be solve the every amazing question that we have for the industry. What it's really meant to do is help companies look at maybe a couple key areas. If I think about demographics, and at Acclaris we have a unique set of clients. So we have people who are in the financial institutions, we have health plans, we have the brokers and consultants, et cetera, and TPAs who all have different goals in why they're going to market to support account-based health plans. And so what this tool really is meant to drive is as an employer or as an aggregator, I want to understand, why is my population of spenders versus savers in line with the market or out of the market? And so, all the trends are very similar to what we see, reported in the industry. I haven't seen anything that would stand out as, truly unique at this point. But more importantly, when I look at different employer groups and I look at different aggregators, we do see different behaviors. So who's using the accounts? We've been doing webinar series on millennials and baby boomers, and there's a lot of data out there today of, how younger employees are not taking advantage of the HSAs, where baby boomers are starting to catch up and put more money into this. You see behavioral trends. So who is contributing in withdrawal? Are people using an HSA as a true savings account, or are they using it as a spending account? And then we're seeing a lot of operational data. Things such as, from a debit card usage, are people submitting claims through debit cards? Are they using this in a consumer-friendly way, or are we still making the consumers and the employees jump through hurdles and submit paper and have a poor experience? And then what are the substantiation rates? How can we help the employers, create, clean plan designs on the HRAs and on the employee reimbursement plans that, make it a seamless experience for the employee? And so, again, no revolutionary insight that has come out of it that I've seen yet, but really putting the power down to our, one of our 6,700 employer groups for them to say, hey, am I the best at what I do, or am I the worst at what I do?
Well, that sounds pretty revolutionary to find some information like that. I mean, your employers have been struggling to get that kind of information. So from that standpoint, at the employer level, it probably is new and revolutionary for them. So they're not focusing on industry studies, but on their own experience, and then relating it, like you said, to some industry benchmarks. So I think it's pretty cool stuff that's going on. What are employers asking you to do to add to that, or what do you see going on in the future as far as new benchmarks or new data? Is there anything new on the horizon that you're thinking about?
Yeah, I mean, we right now we're building a library of reports that they can the queries that they can pull from. Yeah, so we see right now the key ones would be cash versus investment, activation rates, what are the contributions, the quarterly contributions and withdrawals, things around vintage balances in accounts, and then that saver versus spender. And so, and we continue, I believe the library is getting close to 40 reports, or will be by the end of this year, and then we'll continue to build on that and allow people to cut the data however they want. The one thing we do want to keep in mind with this tool is, we don't want to overwhelm our business users. This is not meant for, this is really a tool meant for a non-technical, non-analytical person to get access to those insights quickly, and to then make strategic decisions, whether that's looking at their benefits that they're providing, creating incentives for people to engage in their account-based health plans in a different way, or to identify what best practices they do have, and amplify those.
Okay, Doug.
No, it's so what's next, Seth, for you guys? What's coming next? What do you see in the market? What do you? I mean, you guys are very well positioned in this market, with where the market is embracing account-based plans. The market's moving, and you're part of the Willis Towers, Watson family, as you said. Exciting times for Acclaris. So, I mean, what's next?
So our goal right now within Acclaris product is really, how do we simplify the experience for the consumer, and how do we make our employers and aggregator clients efficient and effective in what they do? Account-based health plans isn't the center of the universe for HR administrator's lifestyle, everyday job, right? What they want is a product that is simple to use, has the highest operational excellence, and and makes their consumers' lives better for today and in the future. And so, really looking at trying to build with the help of Willis Towers Watson, with the investments that they're making within Acclaris, where can we take the product to make a more holistic approach and platform for the consumer, and thus, trickle down effect to the employer's life. Will have less noise, happier consumers, and people who are actually starting to plan for the future and use their healthcare dollars wisely.
Yeah, and happier employers too, right? They have a tremendous challenge with managing all this, right?
Yeah, I mean, and that's really, for us, the consumer experience is the tip of the spear. And if you're not delighting the consumer, you're not delighting the employer, you're not delighting our aggregators, and then, Dean Mason's not happy. So it all trickles down from there.
Yeah, I agree. Exciting times. How do you, when you look out at the changing exchange and marketplace environment, how do you guys see that from Acclaris' seat? Obviously Willis Towers Watson's right in the middle of it. So where do you see that space right now?
Yeah, I don't. How much time do we have? And I think I have to be careful on this one, Doug. I'm a big proponent that the individual needs to continue to take on more, or is going to be asked to take on more and more responsibility of how they spend their healthcare dollars. And if the employers, if ACA, if everyone is going to push that burden onto the individual, we need to provide the tools and technology to enable consumers to make the smart decisions for them. And so, I believe that employer groups, looking at private exchanges specifically, I'm not going to touch on the public. There's just too much out there on the public. But in the private sector, the private exchanges, I really believe that, getting to a defined contribution type model, giving consumers the money to spend the way they want to spend, and then to help let them prioritize it is really important. But if we don't give them the tools and education to make smart decisions, then the industry is going to really lag behind where it could be in the next 3 to 5 years. That adoption will really slow.
I couldn't agree with you more on that. Hey, Seth, it's been great having you on the program again. I want to give you a chance to kind of recap and leave our audience with a few takeaways, if you would, please.
Yeah, it's great. So the benchmarking tools have been in the industry before. What really makes this tool special, and what we want to start talking to our clients about is, what are the insights that we can turn into action to enable them to have higher utilizations of the account-based health plans, to really understand, ask the questions of how this is working and why it's working, and then let's build out a plan together to go solve this and really improve the experience for the consumer and for the employer and for our clients, the aggregators. So this is a easy-to-use, clean tool. We're very excited about it.
Let our listeners know how they can reach out to you.
Yeah, so they can contact me at seth.ravine@acclaris.com, and that's ACCLARIS.com. We also have sales@acclaris.com if they want any information. And they can go to our website, www.acclaris.com.
Seth, great having you on the program. We hope we'll see you soon at one of our upcoming events. You have a great weekend, okay?
Yeah, you too. Happy Father's Day to both of you.
Yeah, you too, Seth. Take care, buddy.
Bye.
Take care.
Take care.